Well, picking up your prescription from a CVS or Walmart is about to get a little more difficult.
Both of those mega chains have announced plans to scale back hours at their pharmacies starting in March. Senior health correspondent Monica Robbins joins us now to explain why this is happening and at the same time why you may also be seeing some sticker shock the next time you pick up your prescription. We already have sticker shock picking up our prescriptions.
I know, and yeah, it's not going to get any easier, folks. I'm really sorry to tell you. Let's start with the sticker shock. Drug prices typically go up in January and July, but according to 46 Brooklyn Research, an Ohio nonprofit drug pricing watchdog, nearly 1,000 medication prices jacked up in the last 3 weeks. We can't say if these price hikes are partly because of the new federal Inflation Reduction Act that will cap Medicare recipients' out-of-pocket expenses and allow Medicare to negotiate drug prices, which starts later this year. But bottom line, talk to your healthcare team and pharmacist about possible options, maybe generics or discounts from the pharmaceutical company. If you don't speak up, you can't advocate for yourself. Meanwhile, CVS and Walmart announcing they'll be cutting back pharmacy hours beginning in March. You'll have to check with the one you use, but one of the reasons cited is a pharmacist shortage. To make sure these changes don't impact your prescriptions, here's some advice.
Work within your healthcare team, including your pharmacist, to figure out where the best place is to make sure that your medication is not interrupted. And oftentimes those pharmacies can refer you to other places that have different hours or 24-hour service so that you can make sure that you are always going to have access to those prescription medications.
And you might want to start shopping around for pharmacies too. Think outside the box. Remember, pharmacies are also located in Sam's Clubs and Costco's, even Amazon. Or see if your plan has a mail order option. Whatever you choose, make sure the pharmacy and your doctor are connected to prevent medication errors or interactions. And the big pharmacies are citing a shortage of pharmacists. While that may be true, the pharmacists are saying working conditions are a reason that many are leaving the profession or going in a different direction. Boyle tells me the field is expanding and there are at least 90 different job opportunities for pharmacists that don't include working in the local drugstore.
Wow, okay, that's huge. I'm guessing, because like everything else, the pandemic has just changed our lives. Is the pandemic to blame for this or no?
You know, the job shortage actually started before the pandemic, but I'm really sure it did not help. Pharmacists, remember, also had to take on all those COVID vaccinations and testing, which may have helped them reach the breaking point sooner. So the need is so big, the big chains are offering $75,000 signing bonuses to attract pharmacists. And the starting salary for a pharmacist these days, Betsy, we were talking about this.
Being nosy.
120 grand out of college.
Wow.
You can
right out of school.
But they've had like 6 years of school.
Yeah,
right?
yeah.
And it's not an easy road either.
It is not, no, and granted, yes, but you know, there is a big need for pharmacists. So if you have a child who's very good in science, maybe want to push them that way.
Yeah.
Well, aside from just getting your medications, the other part is having a conversation with somebody about what medications you're on and going through that list again.
Absolutely.
You're picking up something in the store. How does this going to work? Does this make me feel better? What would you suggest?
I think our pharmacists are really underrated, and they should
absolutely.
Yeah, I'd second that. I mean, in some instances, this medication and mixing of them can be a matter of life and death.
Absolutely.
You want them to be top of their game and to know what's going on.
And you want to know yours.
Absolutely. Yeah. Build a relationship with your local pharmacy for sure. All right, Mon, thanks.